What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, April 11th, 2025. I hope everyone's having a great day so far. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, and you need to be kept up to date and informed of what's going on with each and every one of these viruses, because you know what? Things are constantly changing, and you do not hear enough about this on the news. You get the national news, you get the local news, you get a weather report, you get a sports report, but you don't get a virus report. And I give you a 15 to 25 minute virus update each and every day. I can already tell you right now, today is going to be over 20 minutes. So you want to stay informed with what's going on? Subscribe down below, give this video a thumbs up, hit that notification bell, and of course, share this video with anyone you know, and leave your comments down below in our community. We're trying to build up a nice community down below. And hey, I do respond to comments, and of course you can follow me on all the social media links as well. We'll talk about that more at the end. Alrighty, we do have a ton of things today. Several news stories, a lot of measles updates. We also have some updates on flu as well. Yes, I know we're in the backside of flu season, but the numbers are still being tallied up in some states, and some of them are not so good. And then we do have some new data from the CDC and a bunch of stuff in between. All right, starting off in Ohio today, where measles cases rise to 20. So the number of people with measles in Ohio has gone up to 20 now, and that is as of April 10th. And I'm going to make sure all of these updates in relation to measles do get added to my website, datareport.info, in my measles tracking thread. All right, Arkansas confirms first 2 measles cases in the state since 2018. Arkansas health officials on Thursday reported the state's first 2 measles cases since 2018, both unvaccinated minors who were exposed to the virus during out-of-state travel. So, yeah, this is not a good thing. All right, now we come to my area. I live in Philadelphia, and we do have news from here. Possible measles exposure at 2 emergency room locations in Philadelphia region. Philadelphia health officials are warning about. Sadly, we have identified another case of measles in our region. We believe there is no threat to the general public because of this case. The health commissioner says the first location was Pennsylvania Hospital Emergency Department. That's in downtown Philadelphia. And the second location, yikes, this is not good. Second location was at Holy Redeemer Hospital Emergency Department, which is in Abington Township, Montgomery County. It's up in Huntington Valley. As a matter of fact, that's not terribly far from here. So that is really concerning that measles, it's actually hitting close to home now. Yikes. Moving on to Texas. Here's the update from Texas. And they are now at 541 cases. Just one state alone is now at 541 cases. I'm going to be honest with you. I don't think, this is a really bold prediction I'm making here, I don't think they're going to be the only state that goes into the hundreds this year. I don't know what the other state is going to be, but with the rate we're going here, if we don't continue to contain this, there'll be at least one other state that gets into the hundreds. So 541 cases equals a increase of 36 cases on the April 8th update, since the April 8th update, and their outbreak started back in January. And let's take a look at, actually, let's go back up for a second. 56 of the patients have been hospitalized. This number is the total number of people hospitalized over the course of the outbreak. It is not the current number of people in the hospital. So we got to keep an eye on this, even though it's not the current number. Hey, the number of measles cases continues to go up, or if it just increases much faster, which this increase today in Texas is bigger than the previous day increase. If it continues to go up, yeah, it would be an extra strain on hospitals. Remember, there have been 2 fatalities in school-aged children in Texas, And let's refresh this. I do believe Gaines, there we go. Gaines County leads the way in Texas with 355 cases. Dawson County has 21. Terry County has 47. Lubbock has 38 cases. Lamar has 11 cases. You get the idea here. Then we come over to the CDC, which updated the national number today. And that's now up to 712 cases. I'm going to make another prediction, which this one I think is a pretty easy one. I'm going to go with that the United States probably will, at this rate, go over 1,000 measles cases this year. It's already at 712. This number continues to go up. I don't precisely remember how much of an increase this is from the last update, but yeah, it's still going up. Now, a reminder, they update on Fridays. Also, Texas updates on Tuesdays and Fridays. I don't know that these Friday updates are going to happen next week. That is because next week on Friday is a holiday, Good Friday. We could see the CDC update on Thursday. We've seen that in other years where some CDC data leading up to Easter weekend does update a day early. We'll have to see. If not, it would probably be the following Monday, I assume. All right, so yes, a total of 712 cases reported by 25 jurisdictions. And these are the states that are reporting cases. Alaska, Arkansas, California, Colorado, Florida, Georgia, Hawaii, Indiana, Kansas, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New Mexico, New York City, which is not a state, it's just a jurisdiction, New York State itself, Ohio, Oklahoma, Pennsylvania, Rhode Island, Tennessee, Texas, Vermont, and Washington. If memory serves me correct, the Rhode Island case was fairly early in the season. It may have even been before I started an outbreak thread for measles. I don't know. I'd have to go back and check that on the site. But taking a look here, the majority of the cases are in children under 5 years old. It's 225 cases, or 32%. 5 to 19 years old, 274, or 38%. 20 plus years old, 198 cases, or 28%. And unknown is 15, or 2%. And the majority of them are also unvaccinated. 97%. One dose of vaccine, 1%. Two doses, 2% at this time. And 11% of the cases have been hospitalized, 79 out of 712. And there have been 3 deaths in the United States. Alrighty, moving on. That is enough about measles. Oh, actually, one last final thing. Forgot I even had this up here. There is a potential measles exposure in Texas reported at the Lubbock Christian University. And an alert says, and this was put out earlier in the week. So if you want to learn all about that, maybe I'll make sure that gets put into the measles tracking thread as well. All right, just going to read a headline here. Certain nasal bacteria could affect COVID-19 vulnerability. That's right. Yeah, this is not good whatsoever. So if you have a certain nasal bacteria, hey, you could be potentially more likely to, get COVID or test positive for COVID. Yes, nasal bacteria may actually play a role in your COVID-19 risk. Yikes, that's not good. All right, take a look at this. Record number of flu-related deaths are reported this season in the state of New Hampshire. New Hampshire health officials say 71 flu-related deaths have been reported this season in the state, the most ever recorded since record keeping began 30 years ago. Now, is it the most ever? We can't say that, but it's the most since they started keeping records 30 years ago. The Department of Health and Human Services reported that someone has died of flu-related causes in every county of the state of New Hampshire this season. So it has spared no county. All counties in the state of New Hampshire have had a flu death this season. Alrighty, moving on to this. Not sure why this came up like this, but Michigan has now reported the 7th child flu-related death. That's right. A 7th child flu-related death has now been reported in the state of Michigan. A child in the city of Detroit died after being infected with influenza A. It says H3N2. The Michigan Department of Health and Human Services confirmed on Thursday. Alrighty. In Canada, the COVID viral activity level is low at this time. COVID-19. Hey, low. That's good. This is a change from yesterday when it comes to flu A. Flu A is moderate at this time. Flu B is moderate. And RSV activity level is also moderate at this time. Hey, want to check out my website? It's datareport.info. I do have a bunch of tracking threads. At some point this weekend, I will get to updating them, and I'll be working on a few other things on the site this weekend. I'm going to definitely set aside some time. I know it's Masters weekend. I'm a huge golf fan, so I'll be watching that as well. But I will also be getting some work done here on the website. All right, taking a look at bird migration. Why do we take a look at bird migration? Well, the migration of birds and bird flu could go hand in hand, and the heavy migration areas could be potential spots for new bird flu outbreaks. And take a look at this. New England is seeing an increase in bird migration today. The southeast, pretty much everywhere. Also up here in the portions of the northern plains and the west coast, you're not seeing a lot of bird migration traffic today. You're not seeing hardly any in the mid-Atlantic today. That's because of this right here. Take a look at this. Yes, we are seeing a big rainstorm. You can see here, Washington, D.C., Delaware, Virginia. Yeah, take a look at that. There's a lot of rain going on there. So with all that rain, it's keeping the migration traffic down in those areas. Also, something that tends to happen when there's a lot of moisture, we look at air qualities, and sometimes some of the sensors do get contaminated. Not seeing a lot of it there, but yeah, take a look just to the northwest of that. You can see here across the Great Lakes, even in the portions of Pennsylvania, almost near New York City, some bad air quality sensors readings are showing up. I don't know how much of this is real. Back across the Great Lakes, this could be real. Maybe people are using fireplaces. There is some cold air with this. Some places are actually in the 30s right now. I know it's spring. Doesn't feel like it here in portions of the Northeast. Taking a look at the West Coast, yeah, we do have some bad air qualities out there, and some slightly bad readings in Florida and Texas today, and a few bad readings in Oregon today, which we weren't really seeing over the past couple of days. Pollen levels in the plains are really bad today. I don't need to remind you of that. It is that time of the year. Take your allergy medicine. Here's mine. I didn't take mine today because, I mean, it's raining now. It's cleaning the air. When it rains, the pollen level tends to be lower. Pinellas County, Florida, is seeing a few calls today. Sick person, breathing difficulty, stroke is a thing. Philadelphia yesterday, EMS calls went up just a little bit. 807 EMS incidents were reported for Thursday. Taking a look at what's going on when it comes to calls right now, live in Montgomery County, Pennsylvania, which that is the county that hospital is in. It's in the lower portion of the county in the Huntington Valley. That's where that measles exposure was. And yikes, cardiac arrest showing up. Upper Moreland. That's not terribly far away from that hospital. We're also seeing vomiting, respiratory emergency, stroke is showing up. Yeah, there are definitely some calls going on right now. Altered mental status in Jenkintown. Jenkintown is right next to where that hospital is at. There's two hospitals in that area. Abington would be the other hospital. Taking a look at Chester County, Pennsylvania. Also a cardiac arrest call showing up there as well. And a sick person call. Burns. Yikes. Ouch. Someone's in a lot of pain. Heart problems showing up. So yeah, there's a couple calls there, but not terribly busy at the moment. Taking a look at what's going on with the hospital situation in Pennsylvania. And I'll tell you what, this map is not doing bad, but there is somewhat of a reason for that. I am seeing some grayed out hospitals that are not reporting, but no, we're not seeing many yellow hospitals. 1, 2, 3, 4, 5, 6. 6, that's it. That's the best this map has looked in a while. Let's see what's going on in south central Pennsylvania. Behavioral diversion. Yeah, behavior health issue there. Another one there in the Lehigh Valley, and another one. So we're not seeing a lot of emergency department overcrowding issues. We're only seeing just one that's reporting that. Where is that at? Wellspan York Hospital. So that is some really good news. Can we continue the good news in New Jersey? Yes, we can. Look at this. Not many problems. Just a psychiatric issue at University Hospital, and that is on divert for psychiatric issues. Everything else, it looks like they're still accepting. New York State today, and I got to tell you something. There's going to be some more good news in just a little bit. Yes, at the end of this video. Take a look here. New York State, 1,235 new positive cases. And overall, you know what? Let's go back for a second. Take a look at the chart here. Starting to go down once again now. We've been fooled many times before where it starts to go down and goes back up. I hope that continues. God forbid this is the baseline. Boy, that would be a really high baseline if they were to see another major surge. Taking a look at New York State hospitalization, again, we need to see this dropping, and For the moment, I think it is dropping. 736 people in the hospital, 70 people in the ICU at this time. Taking a look at what is going on in Los Angeles, and we do see a little bit of a change here in Los Angeles this week. RSV has gone up slightly for the positivity rate to 3.35%. Influenza is 6.1%. COVID is 3.54%. Yeah, COVID went up as well. Influenza pretty much just stayed the same. All right, before we continue on, I got to give you a reminder, and you're going to hear this every day until we hit Easter weekend. If you're feeling sick right now, you need to take a COVID test. If you just tested positive for COVID, yeah, chances are you're not going to be well enough in time for Easter weekend. So if you test positive for COVID right now, I'm sorry, I have to tell you this. The time has come. You're going to have to miss out on the Easter weekend festivities. Good Friday, that Saturday, Easter weekend, Easter dinner. You're going to have that ham dinner or whatever it is you do, the Easter egg hunts. You have to miss out. You're sick, and you will risk getting other people sick. And I'll tell you what, just in the last couple of days, or at least today, especially today, I have started to see a few more people wearing masks. Now, the majority of people are maskless, but I noticed in the grocery store today, I saw several people wearing a mask. And the grocery store was fairly busy, so I was surprised. I was actually surprised it was busy. It's raining here. But, yeah, I'm starting to see a few more people wear a mask. And it seems to happen before the major holidays. I noticed it before Thanksgiving. I noticed it before Christmas as well. These are the ones that want to be cautious for Easter. You can be cautious too, especially if you tested positive. Please do not go about your Easter activity and spread it to other people. All right, enough about that. You're going to hear about it over the next week because it's super important. A lot of family and loved ones will be at these Easter festivities. My Easter festivity will be very small. It's just going to be me and two others. My immediate family, my parents. That's it. All right, taking a look at this, I did want to show you something on Wastewater Scan just real quickly. And nationwide, disregard this wonky movement. Now, nationwide, there's a little bit of a rise here. And there's a rise in some of the regions. Let's take a look at that real quickly. We can see the West was going up a little bit. The Midwest has started going up a little bit. The Northeast is going up a little bit. Yeah, something going on here with Wastewater Scan. We need to get to the bottom of it because check this out. I'm now going to show you the CDC. Take a look at CDC. This is CDC for COVID. First off, the national level is low. And take a look here. All regions from the CDC dropped this week. Completely different from Wastewater Scan. Now, the CDC, when I show you this map here, take a look at this. They have way more wastewater sites. But I just showed you on Wastewater Scan that the Midwest is rising. Okay. Now, the CDC for the Midwest says, hold on, not so fast, not rising. But take a look here. Let's zoom into Michigan. Detroit area, incomplete data. Western Michigan, incomplete data. Portions of the Mid-Atlantic, incomplete data. Much of Louisiana, incomplete data. Some portions of Texas, incomplete data. Much of California, incomplete data. You get the idea here? There's a lot of incomplete data. So some people are going to say, oh, well, everything's fine. It's dropping. The CDC says different. They have way more wastewater sites. That they do. But a lot of them are not updated. And I made a post on my Facebook page earlier, the new one, Data Report. I'll show you that at the end of this video. And I did not include that. You know what? I probably should have included that. Maybe I'll include something in the comments there. Something that, hey, there are a lot of wastewater sites that are just not updating. So that could be part of the reason for the disconnect. But there's something else, and I'll show you in just a moment, that kind of leads towards the CDC. And that is this. Okay, it actually is the next thing. Here it is. Emergency department visits diagnosed with COVID. That leans more towards we're not seeing a rise. But there very well could be some localized rises for COVID going on in some regions of the United States. But emergency department visits diagnosed with COVID, they're still dropping. And if you look very closely at the end, that has actually picked up the pace ever so slightly. So, yeah, it's still dropping. And it's actually dropping even more when it comes to the emergency department visits. But again, a disconnect between Wastewater Scan and CDC. We'll just have to continue to follow it. Always assume any person you are around when you're out in public could potentially be infectious. Because remember, asymptomatic spread. It is a real thing. All right, new data, variant proportion data here. take a look at this. This is for COVID. This is CDC Nowcast, and this is based off of very limited data. I believe only one region in the United States. LP.8.1, yeah, 64% of the cases. That's the highest we've seen for any subvariant in a very long time. XEC down to 15%, and just a bunch of smaller little variants. But LP.8.1 really trying to clear the board here. And the good news about that is, though it's doing that, we're not seeing a massive rise for cases at this point. Taking a look at what is going on here when it comes to hospital capacity, and we can see here, percent of beds being used, 74%, so that has dropped somewhat. ICU usage has gone up just ever so slightly, 72.2% versus 72% this week. Taking a look at what's going on with epidemic status, only likely growing for COVID in one place in the United States. That is California. So, again, I'm tending to believe something's going on in California. We're seeing wastewater scan showing some sites that are rising. We're seeing the positivity rate over there in Los Angeles. Not Los Angeles. Yeah, Los Angeles is rising. We're seeing this here, and we're seeing some incomplete data coming out of California. So it is very possible something is brewing in the West Coast when it comes to COVID. And we see for flu, everywhere is likely declining, or not changing. Nowhere is likely growing or growing at this time. And same when we go back to COVID. A lot of places are either likely declining, not estimated, or just not changing at this time. Here's that last bit of good news. This is fantastic news. Look at the influenza-like illness map, and it continues to get better. We only have one place that is in the higher shade of moderate. Nowhere is high or very high for influenza-like illness anymore. New York State is still moderate at this time. District of Columbia is as well, and Maryland is. And then we come down here to the low category, and we still have some places in low, and we do have several states that have now switched over to minimal influenza-like illness activity. That is fantastic news. And some other good news. Hey, I created a new page where you can follow me over on Facebook, and that is datareport.info. I thought it was a good time to do that because I'm on all the other social media pages. So if you haven't liked or followed me there yet, go check that out. Alrighty, folks, that does it for the Friday edition of the Virus Update. We'll have another Virus Update again tomorrow. If you like this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below, and I will try to catch up on all the comments this weekend. Thanks for watching, and I will see you all again next time, and of course, if you don't catch any of my videos this weekend, have a fantastic weekend. Thanks for watching.